Audiology is a branch of science that studies hearing, balance, and related disorders. Those who evaluate and treat patients with hearing loss are audiologists. In this country, approximately 48 million people have some degree of hearing loss. Today, more and more young adults are choosing audiology as a career path. We spoke with Paige Holt, a doctor of audiology at Lake Ear, Nose, Throat, and Facial Plastic Surgery, to find out what drew her to this sophisticated occupation.
My sister and I are both doctors of audiology, and we love what we do. And we feel like we do that because of a strong family connection to hearing loss. Our grandmother was profoundly hearing impaired and has been that way for all of the life that we remember her. And so we both have a passion for people who are hearing impaired and helping them hear better. And she is a great inspiration to what we do. We see many patients upon referral of the physician, and we see many patients who just come in on their own. Probably a large percentage of our client base is from a referral of other patients that are happy with our services. So we get phone calls and people can come in for just a hearing evaluation. Once they come in for their hearing evaluation, if we determine that there is a medical condition involved, then we will recommend that they see the physician for further evaluation before we proceed with any recommendations on hearing aids. However, if we do not detect that there's any problems medically, then we will go ahead and proceed with hearing aids. We have physicians, we have physician's assistants, audiologists, and hearing aid specialists all on staff, and we all work together. And there are times when I may be puzzled on what do you think would be the most appropriate hearing aid for this individual. And so I will walk down the hallway and I will ask my coworker who is a hearing aid specialist, what products have you tried recently? Have you tried a product on a hearing loss that looks like this, and how did it work? And so we work together and we get feedback on one another. It's very rewarding to have a phone call or have someone come in and say, I'm hearing things I never heard before. Having someone say, I wish I would have done this years ago. I can't believe how well I'm hearing. Or just simply putting a hearing aid in and seeing for the first time their significant other, their child, their spouse say, you're hearing me and you were not hearing me an hour ago.
According to the U.S. Bureau of Labor Statistics, this occupation is considered a bright outlook occupation because of its excellent employment potential. That potential is expected to grow 29% by the year 2024. That's much faster than the average for many other occupations. The median annual salary for the position in 2015 topped $74,000. All 50 states have licensing requirements for audiologists, which vary by state. In most cases, a licensed audiologist needs a doctorate in audiology granted by an accredited program.
And Bev, congratulations are in order for the hearing aid and audiology team at Lake Ear, Nose, and Throat. They've been named the best local provider of hearing aids in the Daily Commercials 2018 Best of the Best. Honorees are determined by readers who first nominated businesses in each of the categories and were then voted on over several weeks in August.
For more information on the hearing aid and audiology services available at Lake Ear, Nose, Throat, and Facial Plastic Surgery, please click the Promising Professions story link on our homepage at yourhometownhealth.com.